Doctors say ambulance handover delays in England during the surge in COVID cases over Christmas led to secondary victims in the community. The Royal College of Emergency Medicine says that people died of unrelated conditions while waiting for help. Dr. Faye Kirkland, who's also a working GP, has this report.
The first call to 999 was at 10. It's there.
10:25. Rose says it was her worst nightmare.
Then another call to 999.
While working a night shift as a nurse this Christmas, her teenage children called to say their father was suddenly unwell.
It is literally 5 minutes to the hospital, but because now he could not move, that was the challenging thing.
The family called 999 4 times before an ambulance arrived, 3 hours after the first call.
I can't really expect that an ambulance can take such a long time, having been sounded by children. Forget about the person who was sick, but the fact that the children were in the house alone now with the dad who was unwell.
Robert, seen here, celebrating 4 days earlier on Boxing Day, died of a stroke before the ambulance arrived. Such call-outs should take around 18 minutes. That week, the time it took for ambulances to hand over patients rose sharply with the spread of the Kent variant, meaning for some patients there was no ambulance free to respond to their calls.
He was frightened and he was getting sicker and sicker and sicker by the minute.
Angela Templeman waited for more than 6 hours for her partner's ambulance. By the time it arrived, an existing surgical wound had started to break down.
You don't know what to do in that situation. You've done everything you can. You've phoned, you've called. A GP has said you have to go to hospital and you're too sick to go in a car with me. So we just had to sit and wait. And it was just so frightening. Nobody would listen.
Graham was taken to intensive care with sepsis and is now recovering at home. BBC News has learned ambulance waiting times outside hospitals in some parts of England rose dramatically over the festive period. Freedom of Information requests show waiting times in London rose by 63% for the 2 weeks over the Christmas period, and by 48% in the West Midlands.
It's clear that COVID is creating a whole bunch not only of COVID victims, but a whole bunch of secondary victims.
The body, which represents emergency care doctors, says treating patients in the back of ambulances during the pandemic could have been avoided.
I think it was preventable. If you run a system basically on fumes, you're going to run into problems. The idea that there are patients who've called for help, been taken in an ambulance, and a paramedic has made a judgment that this is a person who's seriously ill, who needs to go to hospital, and they get to the hospital and the whole system that's designed to help them is unable to help them. I think that's absolutely ghastly.
The NHS in England says its services work together to free up capacity, despite a significant increase in the number of patients with coronavirus. Faye Kirkland, BBC News.